You're going to start inside in your vestibule here. This is you're going from your skin, right, up your nose right here, inside of your nose where you could fit your finger if you needed to, right, for some reason. That's going to be stratified squamous, right? Why? Because your finger's up there and you could damage the underlying tissue if you didn't have a nice protective layer right there, right? That's going to be stratified squamous. After that area right here, you're in a protected zone where your finger cannot fit, right? So that's where we start our pseudostratified ciliated columnar epithelia, right there, okay? And so this is going to be lined, all those turbinates, the nasal conchae, right, is going to be lined with that pseudostratified columnar epithelia. And so when you breathe in, your air is circulating around all those turbulates, right? It's warming the air. It's sticking to that mucus right there. So it's picking stuff up as you're breathing stuff in. So this is the first line of defense where things get caught. I take that back. The first line of defense is your nose hair right here. That stuff gets caught in as you breathe stuff in right there. Okay. So the other point is it's highly vascular. It's a thin layer of epithelia, and the blood vessels are right underneath it, right? So just this down here, right, is the vestibule, right? That's on the outside of your body, basically. And once you get into this nasal cavity, right here, this is all like the little spaces that you might see inside that nasal cavity. Here's another picture, right? Every picture you look at, these look a little different, right? So your air, again, swirling around here. This is all these surfaces are going to be lined with that pseudostratified columnar epithelia, right? And it's covered in mucus and everything. So your air is swirling around in here. It's also getting up here. This is where your like olfactory receptors would be, like lining up here, and they'll pick up whatever you breathe in as well, right? So again, you're breathing air in through here. Some of the bigger particles are being picked up by the nose hair, right? But then it gets inside the nasal cavity right here. And your blood vessels, right underneath that pseudostratified columnar epithelial, inside the underlying membrane, the areola tissue and the submucosa kind of area, right? You're going to have all those blood vessels right there, right? So those are bringing in heat to that area, warming up the air right there. So when you do breathe through your nose, right, not only are you picking up particles here, you're warming and humidifying the air. That's making it much more optimal for once it does get into your lungs to really get that rapid gas exchange inside your lungs right there. That's another reason why when you spray Nasonex and steroid spray, it gets into your bloodstream right over here very quickly, right? Because the blood vessels are right next to the airway or surface right there, okay? So once that is going in, filtration, conditioning, and warming is really where you want to, this is where that's occurring right there, right? And so there's times when you have to breathe through your mouth, and that's because you need more air, like you're running and everything like that. You need to get more oxygen, and so you can do all that with your mouth at that point. But optimally, if you can, when you don't have to, you should be breathing through your nose, right? All right, so once it gets past that whole nasal cavity, you enter that first area right here. This is still a protected area. This is not shared with the digestive system right here, right? And this is going to be still lined with that pseudostratified columnar epithelia, right? And you're getting into this area where you're going to be shared soon, and the food, right, is anything you're chewing right here could be in with this in there. So possibly if you're drinking soda right here, right, it can go up into the nasal cavity if there wasn't some protection against that right there, right? So this is your nasopharynx area right here. And below that is when you get into your oropharynx for oral, right, your mouth area, and then you get into your laryngopharynx right next to your larynx on the other side right here, right? So these two areas are going to be shared with your digestive system right here. And so these are going to be with stratified squamous epithelia, right? Because You can't have pseudostratified. That's a delicate layer when you're swallowing a cheeseburger or whatever like that. Or if you're drinking carbonated soda and stuff like that, how do you think that feels if you had pseudostratified epithelia? Has anybody ever laughed soda up their nose?
Yes.
Yes, right. So I'll talk about that in a second, but that whole, anywhere where you see stratified squamous, that's going to be shared with that digestive system. And that's, or the vestibule of your nose right there, right? So this whole area right here, so there's your nasopharynx right here, right? Your uvula, or soft palate, extends to the back of your throat right here. When you're chewing food and you have the bolus, right, you're swallowing it voluntarily, it's going down the back of your mouth. It's going to push that uvula right back and close off that whole your nasopharynx area, and it's going to stop the food or drink from going up into that area right there, right? So, as I mentioned, if you're drinking soda, if you're laughing, this uvula kind of fails. Soda goes up into your nasal cavity right there, and it burns, right?
Yeah.
Remember when you're a kid, the best thing was to make your friend like laugh soda or milk out of their nose, right? And so when you're laughing, this uvula failed right there, right? That's just a fun fact. All right, so that's your pharynx area, and that's really the only interesting thing about it right there. The other thing about it is that whole area, right, for clear passageway right there for when you're breathing in at night. For that whole soft palate right there, right, normally when you're breathing again, it should be opened unless you're eating something. But for some people, when they're lying on their back, right, this kind of closes off that whole airway passage. So this is what happens to sleep apnea, right? Or people who snore a lot, they start breathing and all of a sudden they stop breathing because this airway passage is shut off, right? And that's your uvula doing all that. And right, again, if you look at these models right here, right, vestibule, this is the whole nasal cavity. You can see those turbinates right there where the air is swirling around. Right, air is going down here. Right here is your soft palate right here, or your uvula. And you can see if it was closed right here, it would block that passageway right there. Right? And then going down here, the air is going to move, and then it can either go into your esophagus right here, or into your windpipe, the trachea right here. Right? And then that's where we're going to get into this whole epiglottis thing. At this point, you're kind of looking down into what's called the glottis right there, right? This is your, right here, right? This represents your voice box right here. These pieces of cartilage are moving right here. That's why you could make like weird sounds right there, right? But this, once it's got into this, through this glottis space that your vocal cords are kind of covering, right? You're inside your air. So this right here, right, is your epiglottis, right? And so when you're breathing in, or when you're eating food rather, the epiglottis, when you're normally eating food and stuff, the epiglottis is going to be pushed over and block the airway right there. Here's your epiglottis right here. Here's the food coming down. All this has got to do is kind of close over that area, and then food's going to go down the back right here. Now we're going to get from your, this is in your larynx area that we're just talking about here. You got a couple pieces of cartilage to know, your thyroid cartilage, your cricoid cartilage, right? This is your Adam's apple basically down here, right? And then you get to your cricoid cartilage, which has some stuff on the back attached we'll talk to. And then you're going to get into your trachea, right? So there's all this cartilage going on here that we'll mention, right? But for the larynx, this area right here between your laryngopharynx, right? That was part of that shared digestive tract to the point where your voice box is, right? So again, well, I don't have the picture right there, but that's this area basically right here before you get into the trachea. And that's going to include your voice box, right, as well as your epiglottis. In this case, here's your soft palate closing off food into this area. Here's your epiglottis closing off your windpipe, right, so that food can go down the back right here. And then again, what's the epithelial lining up here? Exactly. What's the epithelial lining right here?
Stratified squamous.
And then what's the epithelial lining down here, right? So you get the pattern here, air, food and air, air, right? It's that simple. And up here, you're going to be doing things to that air. So the pseudocyte, the ciliary, that mucus and the ciliary lining is going to be doing, have certain functions. All right. So I just kind of went over all this. If you have any particular questions, you can ask. I put the slides on here just for your own purposes more like, but this, the cricoid cartilage, right? These little arytenoid cartilages are where these ligaments are attached to. And with your muscle movements right here, these will open and close and allow your particular vibrations of the air coming out, allowing you to make all sorts of noises right there. Right? There's also cool videos if you want to look up on YouTube that they have MRI scans of people like singing, and you can watch these things in action right there. Right? You might have done that for physio. And there's just some more fun facts about the larynx and the vocal cords. During puberty, right, when boys, the testosterone, these secondary sex characteristics enlarge the pharynx area, right, and results in a longer, thicker cords, which somehow, if you know about physics, which I don't, create this deeper voice, as compared to women and children, right? All right, we're going to get down to your trachea here, right? That's basically your windpipe. You can think of this as like a PVC pipe. It's just a pure passageway, right? Your esophagus, a muscular tube is sitting behind it with all that peristalsis movements to push down food. This is purely air conduction. There's not a whole lot of moving or anything like that going on, right? Here's your trachea, kept open by the cartilage rings, right? Here's your esophagus above it, a muscular tube that's going to be expanding and contracting based on whether there's stuff going through it, right? This is always open right here, your trachea, right? Here's some of the stats about it right here. And, you know, this is a cross view right here. Going to be lined with that pseudostratified columnar epithelium. It's going to have these C rings of cartilages keeping it open right here, right? Your trachealis muscle, which is smooth muscle, is on the back of this horseshoe area right here, sitting up against your esophagus, right? When you're swallowing a bunch of food, your esophagus is expanding, pushing up against the trachea a little bit. That trachealis is going to allow for that expansion right there, or during coughing and stuff like that. From your trachea, it's going to branch off into your two main bronchi, your left and right bronchi right there, right? From those bronchi, you're going to branch off into primary, secondary, tertiary bronchi. And so those bronchi, like any tree thing, is going to branch off from bigger to smaller branches. Another thing that's going to happen, right? As they get smaller and smaller, you're going to start to lose that cartilage, right? You need cartilage to kind of keep those airways open because these are relatively big passageways right here. Your primary bronchi are left and right bronchi right here, and they're going to branch off on your left side, right, into these two major secondary bronchi. On your right side, they're going to be branching off into your three secondary bronchi, right? Most importantly, you want to know the size, right? This is a big airspace right here. As they branch off, they're going to get smaller and smaller, right? And so when they get smaller and smaller, you don't need that cartilage to keep that airway open necessarily, right? It's small enough that it can be kept open. That's kind of an important point when we talk about asthma and stuff like that, right? So air stuff is going down. If you happen to swallow anything, right, there's a cough reflex right at the corner right here called the carina. This area is called the carina. And there's a cough reflex center. This on the right bronchi, it's a little bigger, and the slope that it goes in is a little less than on your left side. So if you do swallow something like a marble, right, it tends to go down the right into your right lung. Right? That's just another fun fact. Right? So I want to break here for a second and say both of these, the trachea and the bronchi, are going to be employing those cilia on those pseudostratified ciliated columnar epithelia right here. Right? So they're going to be using this, what's called mucociliary transport, right? So This is your pseudostratified columnar epithelia, right? This is what we're talking about. On here are all the cilia, which are beating like little flagella, right? On the surface of this cilia, you have this layer of mucus sitting on the top right there, right? So when you breathe stuff in, dust particles, pollen, coronaviruses, right? They get stuck, hopefully, in this layer of mucus right here and don't get into your epithelial signs and infect them and cause all sorts of problems, right? So this is your first kind of line of defense about picking up stuff, right? So as you breathe stuff in through your nose, right? Or if it might get caught in this whole mucociliary transit, the beating, right, of those cilia is going to push it down so that you could either spit it out or you could swallow it into your stomach, which has all that acid, chyme, all that gastric juices that can actually kill the coronavirus for the most part, right? And other stuff, right? Any kind of bacteria you breathe in, or you breathe in and does get caught in that mucus, you could swallow it or spit it out, hopefully the former, right? If it does get passed into your trachea and your bronchi, right, that ciliary movement is pushing it upwards, right, toward this area for spitting out or swallowing right there, right? So that's called your mucociliary transport. All right, so once you leave your trachea and you get into your bronchi, the bronchi are going to enter into your lungs, right? They're going to enter into the same little area as all those blood vessels, because your blood vessels are the other important part of what's going on in your lungs right there. When we do get into the vascular system, right, your bronchi comes in here, right? All the blood vessels, your arteries and veins are going to be entering along with it and kind of branching off along with that area right there, right? The bronchi and the little airway passages that you're actually looking at. Everything else is going to be surrounded by other types of lung tissue right there, right? So main bronchi, it's going to go into the lobar bronchi, which is going to branch off into your segmental bronchi. So your lungs have what are called lobes, right? These are separate compartments, right, of your lungs. If you look at a real lung, maybe look up at those cadaver pictures. These are really distinct sort of structures right there, each of these lobes. On your right, you have these three lobes, your superior, your inferior, and then you got this middle one in the middle. On your left side, you only got those two right there. And what you'll hear is that this is because it gives space because the heart is sitting on your left side, taking up a little more space, right? So you only have those two lobes right there, right? So your lungs are sitting inside way back when we learned about those pleural cavities and everything, right? Your visceral, your parietal pleura. Your visceral pleura is the serous membrane attached to the lungs, whereas your parietal pleura is attached to the rib cage and the diaphragm. In between them is the fluid-filled pleural cavity. It's going to seal these membranes together so that every time your rib cage expands and your diaphragm expands, right, it's going to pull the lungs out with it, right? So if you ever heard of like a sucking chest wound or something like that, or pneumothorax, this area has been breached right there, right? And so when you breathe in, when your rib cages, when your thoracic cavity expands, you're just sucking in air and collapsing your lungs like that, right? Right? And so your lungs, right, they're sitting in those pleural cavities, right? They have those lobes and everything. Anatomically, the terminology, your apex is the pointy end that is on pointing the most superior portion. The base is what's sitting on the diaphragm right there, right? When we get to the heart, the apex is pointing downwards. So I just want to mention that here. Right, but that's your apex. Your hilum is the area where your bronchi are entering the lungs, as well as all the blood vessels going in and out. On your left lung, you also have the cardiac impression where your heart is sitting. And you can also see all those major vessels, right, from your aortic arch. When we get to the blood vessels, these are the impressions of your blood, of all those major blood vessels leaving the aortic arch right there. All right, so those lobes, again, Not only the lobes, but all those pulmonary segments, when we get off into the segmental parts, are compartmentalized, right? So if you have cancer or if you have an infection in one of these segments, it doesn't necessarily spread right away to the other segments, right? If you have damage there, a surgeon can remove this little area, right? And these areas won't, well, they will probably be affected a little bit, but they'll still be functional right there. So you could chop off a piece of these lungs right there because of this segmentation, right? Again, this is just a little more than I'm going to ask you about, but just so you understand what's the structure of the lungs, right? These little compartments in which the actual respiratory exchange surface is going, and the smallest bronchi are compartmentalized, right? So when there is damage, they don't affect the whole lungs immediately. You see the bronchi, you see the blood vessels, and then there's this like liverwurst looking stuff everywhere else, right? Everybody see that? Everybody agrees it looks like liverwurst. And then that'll really get to the important point of the lungs, right? Once these branch off, this is all your other lung tissue right here that's going to actually exchange, bring the air down to its final area of gas exchange right here, right? This is the area where you're going to have big problems when you have infections, right? That's going to cause all sorts of problems, right? So at this point, those bronchi have branched off into secondary, tertiary, like 23 times into these bronchioles, right? You've lost the cartilage because these are small enough to be able to keep open, right, without that cartilage. And you'll see they're lined with smooth muscles, right? What is smooth muscles going to do for you? It's going to allow for constriction and relaxation. Why do you want to do that? Because you want to control the amount of air entering your air exchange surface, right? Your respiratory exchange surface. Why do you want to do that? Because sometimes you don't really need a whole bunch of air when you're not doing much, right? When you do need much, you need this relax, you need more air in, right? So this is a point of control, your bronchioles, because it's lined with all these smooth muscle right there, right? When you got cartilage around it, you don't really have that ability to expand and constrict right here. So when we get to the blood vessels, right, this is kind of akin to your arterioles right there, right? Really controlling flow into these surfaces right here, right? So that's your bronchioles. Air's coming in here. It's going to be passed eventually into the terminal bronchioles, where after which you start to be able to exchange gas, actually, right? And the main area of that are these alveolar sacs right here and the alveoli within. We're getting into our alveolar sacs right here. Again, always think, you're bringing air into this surfaces, it's densely connected with all these capillaries because that's the whole purpose, like picking up this oxygen and getting rid of CO2, right? So you have this whole branching of the blood vessels along with the bronchi that are eventually going to branch off into these capillaries here and exchange the surface right here, right? So this is the finish and line right here, right? So when you're looking at these big air sacs, that's a bunch of grapes, right? Each individual grape is your alveoli, right? So your alveolar ducts are going into the sac, which go into the alveoli, right? Again, you've got about 1,500 square feet surface area, right? That's 40 times that of your skin. So your lungs, again, let's take a physical look, or you can imagine them on yourself, right? Here's the lungs, right? This is about life size right here. This area is going to fit about the width of my hand or so, like this and that, inside your space. If you were to expand all this, all the actual respiratory exchange surface, you'd have something more like, I don't know, the size of this whole blackboard, or maybe a tennis court or something, or half a tennis court. Somebody Google that and tell me, right? So it's a massive expansion of surface area with these alveoli right here. So this is where your gas exchange is occurring down here, right? And they're found in these bundles, right, with the bronchioles branched off into there. And they're going to be networked with those capillaries, and importantly, elastic fibers are going to be wrapped around each of these right here, right?